CCHI's conversation dedicated to Minority Health Month. It seems that when in our job, every month, every day is the day when we are confronted with the issues of health equity, of disparities when it comes to serving minorities in healthcare and other areas. So we felt it's important to bring experts in the field to talk to us, to share their opinions of how field evolved. And I'm very excited to have Gabriela Flores, Darci Graves, Gayle Tang, and Wilma Alvarado-Little today with us. They have become mentors and colleagues and good friends to me. Without further ado, I'm giving the floor to Gabriela Flores, our former commissioner as well. We hope she'll come back at some point. So Gabby, start the conversation for us.
Thank you so much, Natalia and Jorge and CCHI. It's a pleasure to be here today. We're going to just quickly do a quick round robin. If you'll just re-say your name for me, your current location, because I think we're respectively in 4 different time zones today, and your organization. And then really in light of this week's historic verdict, maybe just one word that describes kind of how you're coping this week. Darci, would you get us started?
Sure. Good afternoon and good morning, everyone. I'm coming to you from the Baltimore, DC corridor in the state of Maryland. And my name is Darci Graves, and I've been working in the field of culturally and linguistically appropriate services for 20 years now. In a variety of capacities, from medical education through the private sector and as well as with the federal government. In terms of this week, it's been a whole lot of different feelings. There's been relief and sorrow and rage and more sorrow, shed a few happy tears and a few sad tears this week, given all the givens. So
thank you, Darci. Appreciate that. Gayle, would you go next?
Yes. So I'm from California in the Bay Area. I am teaching at City College of San Francisco, a program that I had the privilege of founding over 20 years ago with healthcare interpreting. I am also an independent consultant focused on health equity. Really happy to be here among such esteemed colleagues. In terms of a word to describe this week, it's actually been pretty heavy for a long time now with COVID and with all the activities that's happening with what's going on in the country. I would say it's a combination of a moment of relief and also see a lot of opportunities moving forward.
Thank you, Gayle. Wilma?
Hello, everyone. Greetings. Where do I start? So my name is Wilma Alvarado-Little, and I'm currently located in Albany, New York. And I always smile when somebody asks me, you know, where I am, meaning where do I reside? And I've learned that where you're from and where you live are 2 different questions. And so I currently reside in Albany, New York, and I'm an associate commissioner for the New York State Department of Health and the director of the Office of Minority Health and Health Disparities Prevention. And so it's been quite a jumble of emotions for myself as well this week, you know, thinking about frustration and anger and then hope, and then also how can we move forward? And so it's like all these emotions at once, and I want to remain hopeful and also realistic, because that will continue to fuel my passion and support those who are also dedicated to the work of racial and health equity.
Thanks, Wilma. Appreciate everyone weighing in. My name's Gabby Flores. I'm with Children's Mercy Hospital in Kansas City, Central Time Zone. And I'm with the director of the Office of Equity and Diversity. And I think it's really hard to pick one word because there's been so many emotions this week. But I'm reflecting on one of my managers. You know, we kind of set out the year picking a word, and my word for 2021 is courage. And so I think that really does help me cope with this week, you know, because I share similar feelings of fear and anger, relief, but also having to find the courage to keep moving forward. So thank you guys for entertaining quick introductions. We'll kick it off with just the first question, which our friend Natalia so graciously kind of gave us the idea to think about, which is how has your equity work evolved over the course of your career thus far? Let's start with Wilma.
Oh gosh, how has it evolved? And you know, it's interesting because I don't think that I found this work. I think this work found me. And how do you speak to that in a way that it opens the conversation so that the conversation can continue, right? So we have to create that space so somebody won't walk away thinking, oh, there goes that Latina, she's thinking about this, that, and the other. And so how has it evolved? There's an awareness that one has been supported and to create, right? And so with colleagues such as those who are here and possibly listening, you know, it's without that support, the evolution of one's career regarding racial and health equity, I don't think could happen because it's an accumulation of voices. And so how to be able to work together to send that message and to be able to advocate as appropriate, because in the absence of that opportunity, then it just becomes a conversation. And so then how can we find these opportunities that we have seen and perhaps put into practice and then move them towards a policy piece? And so that to me has been really helpful. And then not only developing that policy, but implementing the policy and then evaluating it so that we can continue to address the needs of those whom we serve and with whom we partner. So I'll just stop there.
Thank you, Wilma. Gayle or Darci, do you want to offer any thoughts on this topic?
I'll go ahead and offer just very quick thought and just really adding to what Wilma had already shared. How it evolved for me, I am seeing more interest in the area of equity. I think that as troubling as it is with all the different activities that's happening, and again with COVID, that people are more sophisticated, they're more open to learning about what's going on. So I am hopeful, definitely from an educator perspective. I found it easier to have these conversations because all these examples are so visible and right in front of us that we can talk about and really delve into. It's just unfortunate that it's like one thing happening after another. It's nonstop, and people are very aware all over from in any age, from students to working adults to seniors. It's just very much on top of people's mind now.
Thank you, Gayle.
So, Yeah, and I would echo that, and to Wilma's point about where you live and where you're from are two different things. You know, when I started this journey, I was living in Kansas City, Missouri, where Gabby's coming to us from, and at that point, when I was teaching this at the medical school, always talked about cultural competency and health equity as that spot on the horizon that we're driving towards and never quite getting to. And I feel like we've made a lot of progress in a lot of the last 20 years because it's not as difficult to explain the work now as it was 20 years ago when people said, you do what? Or, that's not, that needs to be a thing. So in many respects, that part's gotten easier, but there's still a long way to go before we realize more. And I hope that someday we can get even closer to that spot on the horizon. But I think it's always, it's that both and, that reflecting on, yes, there's a lot of, to Gayle's point, there's so, every headline is reminding us of the disparities in social justice, in healthcare, in civil rights, in criminal justice. There's disparities across the board. But the awareness now is so much more than it used to be on a broader scale. I know the communities that we hold most dear and that are serving have known these forever. So I don't want to, make anyone think that we weren't aware that they were here. But the awareness is more, the actions are more, and I think we're galvanizing more people now. And more people are using these words. And so that gives me hope. And I think that's one of the biggest things for me that's come out of the last 20 years.
Thank you, Darci. We just discovered, I think, or I just connected the dots to the Kansas City connection. So I think that's amazing, because I think it's a really small example of the evolution of this work over years. And I reflect on, I went to college for cultural anthro, which of course my mom was like, what is that? And so I've came out of college really working closely as a refugee case manager, working with newly arrived refugees, and then evolved into more of a language access space. And then I would say over these last, definitely over the last 5 years, but probably building up 8 to 10 as the American Hospital Association really started to focus on disparities in care and outcomes with their 1, 2, 3 for equity pledge. I think over these last 4 or 5 years, it's really been about more of a personal discovery that's led to an important translation into operationalizing anti-racism and really deconstructing the systems that are in place. So I think what refugees and immigrants have always taught me all along is resilience and strength and overcoming barrier after barrier, but the systems have to be really broken down and rebuilt. And I feel like we're in a place now where that's beginning to happen. And I'm going to use a med school example because I think we're beginning to really take a deep look at how we prepare physicians in training, but then also how do we've created these systems that have excluded people without really recognizing that's what we were doing. And so it's really about naming it, breaking it down, deconstructing it, and then trying to rebuild a better system. So I feel like that's where we are, and we have a lot of work ahead of us. So I don't want to imply that we've arrived. We have a lot of continued work and continued gas to the pedal. Like the minute you let up, it's like, oh, something shiny over here. And so it can be really challenging. Any other thoughts before we go to another question?
Well, I'm glad you brought up systems, because I was actually had a conversation with somebody the other day who teaches. The conversation was focused on LGBTQ communities and teaching about those issues in medical school curricula and making sure that that we're addressing the disparities that those communities face as well. And I raised the question, I said, 20 years ago when I had started doing some of this type of work, one of the issues that we faced was the medical school students got it, the med students got it. Then they'd go into the hospital and this informal curriculum, the hidden curriculum, would undo so much of what we said. They're like, yeah, I talked about your communication stuff and the doctor said, it's fine, don't worry about it. This is how you actually do it. So we have to do this systemic dismantling. And I'm using euphemisms because this is being recorded and those sorts of things, but because the conversation was anyway. But we have to do that systemic looking because it's the hidden curriculum as well as this marginalization, as well as this, they haven't been underrepresented. They've been left out. They've been excluded. And so, the thing that resonates with me the most right now is, and not to quote memes, because I think we're far too experienced to quote memes, but the means is the system is working as it was intended to work. And that means we have to fix the system because, when we design things, it produces outputs. And when we're seeing these consistent outputs, that means that's how the system was designed. And that means we need to fix our design and our system because otherwise, same outcomes.
Yeah, and I'm glad, I appreciate that there's the opportunity now to have the conversation. But as a woman of color, this isn't new to me. These injustices and implicit and unconscious biases have been present. Now I think there's more of an opportunity to talk about that. And okay, great, people are watching films and reading books and doing this, that, and the other. However, while people are learning, our communities are dying. And so we need to be able to continue to have others and ourselves lean into the discomfort of some of the conversations that we need to have. Because if we don't take advantage of this opportunity or utilize it to empower our communities, then what are we doing? So I'll just there.
Yeah, I agree. I really appreciate hearing from the both of you, all three of you. I think the systemic change is so critically important for those of us who are educators, either in medical school or with interpreters and whatnot. It's really important to make sure that they have all this knowledge. But to your point, Darci, when they get into the system, all of that could be undue if they don't have the courage to sustain and really practice what they learn, because there are so many systemic barriers. So we have to be able to figure out how do we educate from the ground up, but also have the right leadership and the courage to break down those systemic barriers so that it can really allow us to move forward with this health equity agenda. So there was, every time I think about this particular topic, it just makes me very happy to see, those of you who are still around, who are so courageous and who is sticking to it, right? Because it's easy for us to give up. And I just want to give a shout out to the CLAS standards. It's been around for a long, long time. It first came out in 2000, and then Darci, under your leadership, and everybody involved on this panel, revising the standards, that I really hope that people will take a closer look at that and really try to operationalize that, because I think there's a lot of answers with in those standards,
Yeah.
that if we all align ourselves, we can move forward together better.
Thank you guys so much for really engaging conversation around that one question that maybe led us down a little rabbit hole, which is exciting. I love these kinds of conversations. Maybe changing direction slightly and talking about the current public health crisis and pandemic of COVID-19, and especially thinking about the disproportionate impact on communities of color. How did COVID affect you personally over this last year, and then professionally? What have you seen in terms of how it's played out over the course of the last year, whether it's access to, precaution, information, testing, vaccination hesitancy, all of that? Just maybe give a little thought or appreciative inquiry to COVID impact, especially for communities of color. Let's see, Gayle, would you mind starting us up on this?
Yeah, sure. So COVID really impacted all of us a lot, right? In a lot of different ways. At a personal level, I can't complain, when I see all the inequities out there, and so many people who are essential workers that need to be out there doing the work, and maybe not speaking the language and coming down with COVID. It has just been a horrific experience. Definitely from an educational level, it's been very, very difficult to find internship opportunities for the students, because the hospitals could not bring on any students because of PPE issues and all of that. Very understandable. But the positive thing was that our students were able to do internship as a contact tracer or case investigator, and really learning about public health in a big way, very relevant way, and working at the hubs and doing testing and vaccination and all of that. So our students actually became a critical workforce in this COVID pandemic, bringing their linguistic and cultural skills as well. So they're continuing to do volunteer work even though they're done with internship. Right now, what's critically important and very concerning is the vaccine hesitancy, right? We know that there's a number of people who still don't want to take the vaccine. They don't understand it. And for people who do not speak the language, they really don't understand it. Even with some language specific media, it's just not getting out to people quick enough. And with all the anti-Asian activities going on, our seniors and younger people also of Asian community are afraid to go out, even if they say, yeah, okay, I'm ready to get a vaccine, but they are afraid to step out of the doors. And it's very serious. So I'll stop there.
Thank you, Gayle, for reflecting. Wilma, any thoughts on COVID?
Yeah, well, gosh.
Yeah, I know, it's a big question.
Just a few.
So many thoughts.
So where do I start? So with the beginnings of the pandemic, the concerns, some of the thinking that folks had to think about, I think in general and as a society, is that not everyone lives in a single family home with 4 people and everybody gets a room, right? It can be very traditional in some of our communities where the households are multi-generational. So that population density is more than, 4 people in one home, right? Because it is multi-generational, and that's our community. And so when we're thinking about contact and those who are, many of our communities are first responders who have to go out literally and physically and figuratively into a workforce situation where they're not working remotely. So there was I appreciated there being a recognition of that not everybody can work remotely or remote in and have access to technology, right? And then, as somebody had mentioned in a different conversation, we don't know where people were able to access Wi-Fi. Were they sitting in their cars next to some business, or we don't know. So these were some of the things that I thought were I appreciated it becoming a lot more common knowledge, as opposed to, oh, we didn't think about that. Because as communities, we think about that because we have to go out there, right? So that, I think, was one thing. And then working towards equitable distribution with the vaccine. That's something that I think we really, really need to be able to think about again, and also the vaccine hesitancy because of the myth versus fact. And so I happened to stop by one of our vaccination points of distribution this weekend, and it just really, if anyone had thought, at least in this one certain area, that the Latino community was not interested in getting the vaccine, guess what? No, they were there because it was the facility and the organization who had the pop-up is trusted within the community. So if you cannot be trusted during a pandemic, then get ready when this settles down, because the memory of who can be trusted and who couldn't be will continue. And so we need to be very mindful. I feel we need to be very mindful of that. And then regarding the language access piece, we've worked really hard to ensure that language services are available at the New York State facilities. And also, because we think about spoken, we also have to remember our deaf and hard of hearing communities who have also had their challenges during the pandemic. And so remembering and having considerations for utilization of services as well, that's really huge. And I'm not saying that every system is perfect, but I feel that those of us who are in this work and have that awareness are doing everything we can with the resources we have during the pandemic. And to answer questions very honestly as to, what about this? What about that vaccine? We're not going to know all the answers. And we have to be very honest. And I think saying I don't know is a very sophisticated response. In healthcare, that's not an acceptable response, right? Because you always have to have the response for your preceptor. You have to, as a language, as an interpreter, there's the expectation is that you're able to convert from primary to secondary or target, one to the other language, and to be able to stop and to clarify and ask for that clarification of a term that may be a little bit different. We have a system in place built in for that as interpreters. However, how can somebody say, I don't know, when the expectation in the healthcare training is that you're supposed to know, right? And I hope I'm not overstepping when I say that.
Yeah.
So how can we create that space to say, I don't know, but what I can do is refer you to information, maybe suggest you speak to so-and-so who might be a better resource. So these are some of the things that for myself have become more common than prior the pandemic.
Thanks, Wilma. I think that's a really great segue to maybe our final question, which is and especially in light of our audience today, who may be medical interpreters in the field, what actionable efforts can interpreters take, whether it's kind of in that larger domain of health equity or very specifically around COVID mobilization? And so maybe Darci, would you help us close with this question?
Sure. Yeah, I want to be mindful of time. I think a lot of what Wilma just hit on, the trusted messages, the trusted messengers. I mean, communication has to be, for communication to be successful, it has to be received and understood. So if you don't have trusted messages and trusted messengers, you're not successfully communicating. And so having interpreters serve in that capacity is huge, and having the roles as cultural brokers, all of those connections, and thinking about those things, and thinking about all of the pieces that Wilma raised, thinking about the technology, thinking about the broadband deserts, thinking about all of those things, because it all has huge implications for so many, our rural communities, our tribal communities, so on and so forth. But I want to pass the mic to my colleagues.
Yeah. Gayle, any thoughts before we wrap up?
I would say that, and I've always said this, is that interpreters are in such a powerful, powerful position. All the roles that they can take on that goes beyond just converting the message. They can be, like Darci says, doing cultural brokering and also advocacy, even though a lot of times interpreters are maybe trained to shy away from advocacy. I would say to lean in, because there's a lot of different ways that one can advocate, right? And just really to add to interpreters and all of us having a bigger macro view around health equity is to do everything that we do with a cultural linguistic lens. Just very quickly, even with scheduling with the vaccines, it is so hard for English speakers to schedule an appointment. I'm not going to go into my own personal experience in scheduling, but can you even imagine anybody that don't speak the language, from another culture, don't know how to use the internet? So I would say think bigger, because if all the systems that got put together took a cultural linguistic lens, it will take those things into consideration, but instead, with the best intentions, have created even more systemic barriers that we need to deconstruct. So I would encourage all of us to really think at a very macro level, always put on that cultural linguistic lens whenever we're creating anything. And I'm going to go back to the CLAS standards again.
Yeah. We worked hard on that.
We did.
It's
so relevant. It is so relevant.
It really is. And then you add that cultural and linguistic component to it. We're not even talking about health literacy yet.
Right.
So, anyway, I think we need a part 2, Gabriela.
I agree. I think we should schedule a part 2. And I just want to appreciate everyone who's offered insights and reflections today. So thank you to Darci, Gayle, and Wilma. And thanks to CCHI, to Natalia and Jorge for convening these really valuable conversations. And I'll just say from my own experience, I think there's lots of ways that interpreters can mobilize and get information. And I love your comment, Gayle, about interpreters being trained, maybe downplay the advocate role. But I feel like in a health crisis like we're in right now, we have a moral obligation to get information to people in ways that they can utilize it the best, right? And they're going to trust us as that messenger to bring them trusted information about vaccine, or even, go here, Fulanita will help you get your vaccine coordinated. I did the very same thing with my parents, utilizing back channels to help get them vaccinated when, their technology was limited. So I just will leave you guys with a call to action for interpreters across the country to get involved, whether it's donating your time to clinics and pop-up events, or even just spreading the word when you get, just today I got a message about a bilingual vaccination clinic. And so how do we get those messages out? Because I know you guys are really well connected. So interpreters can mobilize to help get vaccine to our really vulnerable refugee and immigrant communities. So I think with that, we're a little bit over, but I appreciate everyone's time today. And Natalia, I don't know if you have any closing comment for today.
I want to thank you from the bottom of my heart. It was a very rich conversation. I agree we need part 2, part 3. I could talk with you for 4 hours straight without any breaks. But we also understand that, we have competing issues in our lives. And I think it's important to keep this, bringing the macro picture, the big picture of the health equity to the minds of the interpreters, and then translate them as you did into the actionable things that, the role of advocate has not been eliminated from our code of ethics. Yes, it is hard to do. Yes, there are boundaries, but we do need to make that conscious effort to remember it and act. And the crisis that multiple crises that we're living in is a good opportunity to develop that skill of advocacy for our populations. Again, ladies, you are inspiring, and it was such a good moment to have you with us. Thank you very much. And everyone, there are lots of comments coming through from the attendees thanking you, and especially for the words of hope and courage. So have a wonderful afternoon, and let's go back to work. Let's go back to advocacy and to serving our communities. Thank you, everyone.
Thank you.
Thank you.
Thank you. Thank you.